What could possibly hinder the rise of a man's pride and joy? A question that might instigate chuckles, but it's a serious matter. Erectile dysfunction, or ED, is a common issue that affects many men worldwide. But what exactly causes a man not to get erect? There's a myriad of factors that could come into play. For starters, problems with your heart and circulatory system could be the culprit. When the blood flow isn't quite right, it can throw a wrench in your erections. Similarly, issues with your brain and nerves can cause ED. If the signals aren't being sent or received correctly, it could lead to erectile difficulties. Now, let's not forget about hormones. When these chemical messengers are out of balance, it can certainly affect a man's ability to get erect. But it's not just physical factors that can cause ED. Psychological issues can be just as damaging. Performance anxiety, depression, emotional relationship issues, and even a porn addiction can potentially lead to ED. And of course, we can't overlook the impact of substances on the body. Certain medications, illegal drugs, and alcohol can all contribute to erectile dysfunction. So, if you're experiencing ED, it's crucial to delve into the root cause, as it could be indicative of a serious medical issue. Sudden erectile dysfunction might be alarming, but it's usually linked to psychological issues or substance use. Gradual ED, on the other hand, could be signaling that your circulatory, nervous, or endocrine systems are struggling. Regardless of the onset, it's always a good idea to consult with a doctor to rule out any medical problems. Now, what about morning wood? This common phenomenon can actually shed light on the nature of your ED. If you're experiencing ED but still wake up with morning wood, it's a sign that your body is physically capable of producing erections. Therefore, the issue might be psychological. Conversely, if you have ED and have stopped experiencing morning wood, it could indicate that your ED is caused by a physical medical condition. So how do you treat erectile dysfunction? There's a whole array of treatments out there, from penis pumps to lifestyle changes. Some of the most effective treatments are prescription medications like sildenafil, vardenafil, or tadalafil. They work by improving the blood flow to your penis, helping you achieve and maintain an erection. In conclusion, while waking up with morning wood might seem trivial, it's actually a good sign of your penile health, and if it stops, it might be an early warning sign of something more serious. So if you notice any changes, don't hesitate to consult with a doctor. Remember, your health is always worth the effort.